Hello, everyone. My name is Vitaly Napadow, and it's a distinct pleasure to be here to present to you all as part of a panel at the Osher Integrative Medicine Forum. And today I'll be talking about acupuncture. So I am a associate professor in the Department of Radiology at the Martino Center for Biomedical Imaging at Mass General Hospital. But I'm also a practicing acupuncturist and work at the Pain Management Center at Brigham and Women's Hospital in the Department of Anesthesiology. And today my talk is going to be about acupuncture and the importance of research in boosting interprofessional practice and integration. So I want to first touch on some recent milestones in acupuncture integration. So for example, in 2017, the Joint Commission, or JCO as we know them, which accredits and certifies healthcare organizations in the US, revised its pain management standards requiring hospitals to offer non-pharmacological options, including acupuncture as well as other integrative medicine modalities. And in fact, a direct quote from this was that it is important to have non-pharmacological pain treatment modalities available for patients that refuse opioids or for whom physicians believe may benefit from complementary therapies. And that's, I think, been a big driver in the last few years for greater acceptance of acupuncture in conventional healthcare is the opioid epidemic, which continues to rage while other epidemics and pandemics do as well. So interestingly, acupuncture is now available in many US hospitals, and greater than 60% of National Cancer Center NCI designated comprehensive cancer care centers as well. Acupuncture is also covered in the VA, in the Veterans Health Administration. That's been a big boost for greater acceptance of acupuncture in conventional healthcare. And in January of 2020, this was a major milestone. Acupuncture for low back pain was approved by the Centers for Medicare and Medicaid Services, allowing seniors especially to have access to acupuncture for their low back pain, which is probably the leading cause of chronic pain in the community. So this is a specific CMS guidance on acupuncture for low back pain, and it talks about how there would be Medicare coverage for up to 12 acupuncture visits for chronic low back pain patients, and that an additional 8 sessions would be covered if the patient shows improvement and no more than 20 acupuncture treatments can be given annually. So what is the problem with this? Well, first of all, this only covers low back pain. We know that acupuncture is likely to be effective for other chronic pain disorders as well. And another problem with this is that the question of who can provide acupuncture under Medicare coverage. And currently, the stipulation here is that it's physicians or MDs can provide this coverage, or DOs as well, but also physician assistants, nurse practitioners, only if they have a master's or doctorate degree from an ACAOM accredited program. So basically, they also are cross-trained as an acupuncturist. And then there's a discussion about quote unquote auxiliary personnel. This is likely referring to licensed acupuncturists who make up the bulk of the acupuncture workforce in this country under quote an appropriate level of supervision. And this just means by physicians or the above mentioned physician assistant nurse practitioners. So licensed acupuncturists are able to provide acupuncture under this Medicare coverage, but only if it's signed off on by a supervising physician is my understanding. And so these are all kind of barriers and hurdles to greater acceptance of acupuncture, but still I don't want to really not mention the fact that this is a major step forward and is probably just the first step in greater acceptance of acupuncture in our conventional healthcare system. So the one question is why did CMS make the decision to cover acupuncture for low back pain? Well, I think the real reason is due to the growing body and the probably extensive body of research and acupuncture research from clinical trials. And I think a big driver for this is the ATC, the Acupuncture Trialists Collaboration, which was an individual subject data meta-analysis. So meta-analyses of clinical trials are pretty common. A lot of you have likely seen these, and this is basically a conglomeration of the currently published RCTs in a certain field But what made this effort different is that a lot of the lead researchers from a lot of these clinical trials got together and actually contributed the individual subject data from their trials. And with this, they were able to create a database of 29 trials with almost 18,000 patients included from these trials. So these are all trials of acupuncture for different pain disorders. So 18,000 patients are in these trials. I wanted to highlight that. 20 trials included sham controls with over 5,000 patients, and 18 trials included non-acupuncture controls, almost 15,000 patients. This was published in 2012 in Archives of Internal Medicine. So the results from this individual subject meta-analysis for low back pain and neck pain was that the bulk of the data showed that the clinical outcomes favored acupuncture over the sham acupuncture control. And when looking at the statistical significance and effect size, because of the large number of subjects here, there was a statistically significant difference between real and sham acupuncture, but the effect size was small. So about 0.15 to 0.2 for different chronic pain disorders, including migraine, osteoarthritis, low back pain, neck pain. And these effect sizes, I should say, are on the order of, say, for example, NSAIDs. If you look at the effect of NSAIDs for chronic pain, it's around on this order as well. However, when looking at acupuncture versus non-acupuncture controls, and this is typically usual care and waitlist controls and things like this, there we find a larger effect size. These are much larger studies, by the way. You can see the numbers here are in the thousands sometimes, versus the sham acupuncture control data, which was roughly in the hundreds of subjects. So here we have larger effect sizes. These are on the order of 0.4, 0.5. So these are moderate effect sizes for acupuncture, improved clinical outcomes compared to non-acupuncture controls. And so the conclusions as reached by the Acupuncture Trialists Collaboration, the ATC, was that acupuncture is effective for chronic pain with a moderate effect size. The difference between acupuncture and sham acupuncture was statistically significant, but with a small effect size. And so my opinion here is that these conclusions greatly contributed to the CMS decision to cover acupuncture for low back pain just recently in 2020. So how do we go from research to the clinic, and what are the hurdles to greater integration of acupuncture in our conventional healthcare system? So first of all, acupuncturists must first gain access to hospital patients, right? First of all, we need to get more acupuncturists into conventional hospital-based clinics. Hospitals and acupuncturists must obtain reimbursement for these acupuncture services. That includes, credentialing, billing, everything that's involved in getting these visits reimbursed. Acupuncturists also need to effectively communicate in a hospital environment. So our typical training programs for acupuncturists do not always stress communication with MDs, with other caregivers in the conventional clinics and hospital-based systems. And so we need to have, I think, a better training for integration of acupuncturists in order for them to be comfortable in speaking the lingo inside of hospital-based systems. I think this is a real must. And greater research literacy is, I think, a big part of that as well. So some examples, though, do exist here in the Boston area. Acupuncture has been integrated into the Harvard Medical School system. It's currently available both as an out-of-pocket expense and/or insurance billing at Brigham and Women's Hospital, including the Osher Clinic and the Pain Management Center in the Department of Anesthesiology, which is where I practice acupuncture. Dana-Farber Cancer Institute, Mass General Hospital at the Cancer Center and in the Pain Management Center has acupuncture available, and in the Spalding Rehabilitation Hospital Network. And a lot of the satellite clinics for Spalding do include acupuncture as well and access to acupuncture. So this has been, I think, a major sort of effort over the last decade. And the fact that here we are in 2020, having acupuncture available at all these conventional hospitals is, I think, a major milestone in broader acceptability of acupuncture in conventional healthcare. Also, I wanted to mention the NISA clinics. NISA, the New England School of Acupuncture, the oldest acupuncture school in the US, has been sort of at the forefront in embedding their students and interns into conventional hospital clinics around around this region. So interns are typically placed in the third year of graduate study. They complete 12 rotations, 60 clinical hours each. And there's many hospitals around the region, both in Boston at, say, Boston Medical Center, and in Shattuck Hospital at Jamaica Plain, but also in other towns around the Boston region, such as Bedford, Lynn, Worcester, Malden, and Waltham. And so the conclusion, and I wanted to kind of finish on a high note, is that acupuncture integration is happening. And how do we cross the finish line, per se, is we need greater acceptance of acupuncture for pain reduction, which then opens the door for future coverage of acupuncture for other symptoms and other disorders. And hopefully we will see that in terms of both Medicare, but also Blue Cross Blue Shield and other insurance systems will hopefully start to cover acupuncture more for pain, but also for other conditions and disorders as well. More acupuncturists and increased visibility for acupuncture within hospital and conventional care clinics will lead to more normalized attitudes and greater acceptance. So just the fact that acupuncturists are working in these hospital systems, interacting with physicians, with nurses, with all the other personnel in these hospital systems, brings acupuncture more visibility and broader acceptance, I think. And I think we'll see this more over time. And the importance of research here, I think, is important as well, because it's really the research that first opened the door to some of this greater acceptance. And so I would love to see a continuation of acupuncture research and efforts placed there as well. So I wanted to thank you all for paying attention. It's been a real pleasure, and I look forward to the panel discussion with my co-presenters.